hit of aware this month, so we're gonna talk about schizophrenia. I'm gonna do a little snippet. I'm not gonna break it all the way down. I'm gonna do a snippet. So schizophrenia is a disorder where we have a chemical imbalance of serotonin, dopamine, and glutamate in the brain. Schizophrenic patients, studies have shown, not me, studies have shown that schizophrenic patients have a structural abnormality in the brain, which could be congenital or acquired. When they run scans such as CT scans, MRIs, PET scans, schizophrenic brains versus the non-schizophrenic brain tend to show that they have less gray matter in their frontal lobe and in their temporal lobe than the brain is not schizophrenic. These patients have trouble distinguishing reality versus non-reality. They struggle with how they may act, how they may feel, and their behavior. These patients develop schizophrenia whether it's inherited from a family member, whether it is a psychological or an environmental factor. We know if we have a family member, a immediate family member, such as our parents or grandparents or siblings that have schizophrenia, have been diagnosed with schizophrenia, and it is inherited, then we have a great chance of developing an increased risk of developing schizophrenia. But if our relative has schizophrenia and is from an environmental exposure or something psychological, then our chances are decreased. Psychological factors, I'm gonna give a few, a couple. Some type of bad stressor in your life, some type of traumatic event that has happened, some type of abuse, whether it's physical abuse, emotional abuse, something like that. And as far as environmental factor, this can happen in utero when mom is carrying the baby. If you're exposed to some type of toxin, and besides after birth, you can still be exposed to toxins where you can develop schizophrenia. A bad virus, some type of bad infection, medication. Sometimes medications, the side effects of these medications, especially if it's too strong, you take too much, you can experience hallucinations. And my goodness, drugs, recreational drugs. This is our biggest factor that is causing schizophrenia among most young men. These drugs are laced, a lot of them, and if they're not laced, you can abuse these drugs where you can cause this chemical imbalance in your brain, and you can start having these symptoms of someone with schizophrenia where you wouldn't have them. Patients with schizophrenia, let's talk about what they experience. They experience hallucinations. So it could be auditory, which they can hear things, auditory hallucinations. They may hear things that we don't hear, and you feel like, I don't hear that, or they lying. But they really do hear things in their mind. They hear things, they hear voices. They may see something, which is visual, that you don't see, but they see. Tactile, they may feel someone is rubbing on them, or something is crawling on them. You may not feel it, but they feel it. They have trouble perceiving reality versus non-reality. They experience negative symptoms and positive symptoms. Medications tend to work a little quicker on the positive symptoms. Positive symptoms are the hallucinations that we talked about. Delusions, which is a false fixed belief that you will more than likely not change. But example, the person on the TV is talking directly to them. That's their delusion. The president of the United States is their father. That's their delusion. It could be multiple delusions. I'm only giving a couple examples to try to get you guys to see. Sometimes they experience command hallucinations, which are bad because it tells them to do things. These hallucinations can be happy thoughts that's talking to them and telling them to do happy things, or something. The command hallucinations is what tell them to do stuff. And sometimes that's how people end up killing themselves, because they listen to the voices and the voices tell them, you are not wanted, you are no good, you don't belong here, I hate you, kill yourself. They tend to listen to these command hallucinations. But just in general, everyone don't experience the hallucinations with the bad demonic voices. Some do and some don't. Either way it go, you shouldn't experience it at all. The trick to this schizophrenia, there is life beyond schizophrenia. You can live a normal life. And they always say that schizophrenics tend to live about 20 years less, give or take, than a non-schizophrenic person. And that's simply because most of the time they are not taking their medicine, so they don't know when something else is going wrong with their physical body because their brain, their mind is not stable. But we did talk about the positive symptoms. That's what your medicines can treat quicker. You're going to have hallucinations, delusions. You might be experiencing some type of bizarre behavior. Your judgment may be cloudy. You might have trouble concentrating. You might have some speech impairment or some speech problems. Those are some positive symptoms. Some negative symptoms are going to be some things like flat affect. You're looking all the time. No emotion. Blunt affect, which you may get a little smile here or there. These people have no motivation at all. Nothing motivates them. Lack of motivation. What else do they have? They're hopeless. They have those suicidal thoughts. Those are the negative symptoms. The medication can treat the negative symptoms, but they tend to work quicker on the positive symptoms, and it takes longer to work on the negative symptoms. Take your medications, and if you can get in some outpatient therapy and medications go hand in hand. They are both needed. But you have to take your medications. Family members, friends, cousins, husbands, wives, whoever. If you have a family member that is schizophrenic, it is your duty to make sure that they take their medication, because they will forget to take their medications a lot of time, and sometimes they will feel like they don't need their medications. It is your duty to make sure they take their medicines. Check their mouth, check their tongues, check the jaws, check their lips to make sure they're not hiding. And when they swallow their medication, make sure that they sit somewhere in your reach where you can make sure that they're not vomiting their medication up. If these patients take their medications the way that they are directed, we would have less relapse. We have so much of a relapse because patients are not getting their medications. And I do understand sometimes that families may tend to get burned out because, you know, it's a job dealing with someone with schizophrenia that's uncontrolled. But there is life beyond schizophrenia. You can live a normal, healthy life, but you have to remember to take your medicines. If you don't have anyone to help you take your medications, you may want to think about a longer acting medication like an injection. But you want to make sure before you get this injection that you have had some type of work to make sure you're not allergic to this injection that the doctor may prescribe. Sometimes with these medications, it is trial and error because you don't know what will work for you. What may work for one may not necessarily work for you. But there is life beyond schizophrenia. That is schizophrenia in a snippet. If you need to know something else, just let me know, because I'm trying to talk as fast as I can. I know I kind of jump, skip, hop, but I pretty much wanted to talk about schizophrenia. But these patients need help. We have to break the stigma when it comes down to schizophrenia. It is nothing no different than having a diagnosis of hypertension, diabetes, lupus, rheumatoid arthritis, HIV, cancer. Something is wrong with a lot of people. Break the stigma against people with mental illness. I will talk about something else dealing with mental illness later. But the first thing I want to talk about is schizophrenic. They perceive things differently. They have trouble distinguishing reality versus non-reality when they are not taking their medications. So help these people, lend a helping hand. If you can't do anything or say anything positive to uplift them, don't say nothing at all. Stay away from drugs. We have so many young men that is diagnosed with schizophrenia because we go from drug-induced psychosis and they don't stop until drug-induced schizophrenia. Once you get that label on your chart, you will have that diagnosis forever. Stay drug-free. You are a payment to these drug dealers. You're making their pockets fat. They don't give a rat's behind about you. Peace.